Of the Maine People's Alliance are going to put in a referendum, using the referendum process to expand Medicaid, to take the federal Medicaid expansion from the ACA. And you have been, you've kind of been on that team. You have broken away from the majority of your party in the past to support taking that money and expanding Medicaid. So from your perspective, why is expanding Medicaid a good idea?
Well, I still think it's a good idea, although not as good an idea as it was back when I sponsored it a couple of terms ago, because back then the federal government was going to pay virtually all of the cost of that expansion. And now, by the way that law works, it's ramping down to 90%, so the state share is going up. Part of that discussion, I think it starts from the issue of what is Medicaid? Right. Is it a welfare program? Or is it an insurance program? If you think it's a welfare program, then you may have one immediate visceral reaction to it. If you view it more as an insurance program paid for by the federal government, you might look at it differently. From my perspective, I thought it was a good idea because it was going to bring literally a couple of $1 billion over time into the Maine economy. If we had a new destroyer contract for that much at Bath Iron Works, everybody would be celebrating. This is federal money. I know it's tax money, but it's our money that we've sent to Washington that now will go somewhere else if we don't take it back. Secondly, if without Medicaid expansion, it doesn't mean that people are any healthier. In fact, probably the contrary. But if people get sick and they don't have insurance, they're not going to go to their doctors, and they're not going to go to their hospitals until it's an emergency and until it's already gotten to the point where they're very sick oftentimes. And there's no free lunch. Someone is going to pay for that. So it's either going to be the hospitals are going to eat those charges, which is going to make them increase their charges to insurance companies, is what often happens. And our private insurance rates are going to go up, or we're going to have to put more money into hospitals some other way. So I saw that as different from many of my colleagues. I don't necessarily view health care as a right, but on the other hand, I think that we all have, if we had an opportunity to get something mostly paid for by the federal government, it's going to keep our hospitals healthier, it's going to keep our people healthier, and it's going to be bringing money into the Maine economy. I mean, this money doesn't go to people that sit on the couch. This goes to physical therapists and the janitor who pushes the broom in the hospital and the doctors and the nurses and your neighbors and mine. That's who ends up with the money. I thought it was a good idea, and we should have done it. And we did do it, except the governor kept vetoing it.
Yeah, he will tend to do that. So I want to talk really quick about the Medicaid expansion we did before the Affordable Care Act passed, because we did one at the end, I want to say at the end of Baldacci's term. So if we expand Medicaid, is it going to be, because right after the ACA passed, it was going to be 100%, works its way down to 90%. Would we have to pay some into the, I guess, Medicaid charges from before the Affordable Care Act? Would we have had to do that, or am I?
It's very, very complicated. I'm not sure of the answer to that. And by the way, that discussion is all premised on what the Obama administration was willing to do. We don't know what the Trump administration is going to be willing to do on any of this stuff. I mean, there's talk about changing the entire Medicaid program from the way it is now into a block grant, where the state of Maine would just get a bunch of money and we could run our own program. And it's early in the administration, but we haven't had really much indication yet from Washington what their plans are. So who knows?
And that, and this is more of a federal issue, and I don't really know what your stance on Obamacare is as a whole. But when you're talking about repealing Obamacare, you get a guy who's working poor. He makes a little under $30,000 a year. He's 58, and he's on Obamacare. His actual premium is too expensive. And the government is subsidizing most of it, if not all of it. And without that subsidy, that guy's premium is prohibitively expensive. So do you think reasonably we're going to be able to just say, nope, those subsidies are gone, we're taking them back to Washington, and you're on your own? Is the federal government going to do that?
No, I don't think so. And I think that's why you saw the failure of the plan in the House of Representatives and the Republican Party, because I think there's a realization that we can't go back that way again. But I've always found this debate really kind of, from my perspective, Sam, focusing on the wrong thing. We talk a lot about access. We talk a lot about insurance. But you know, to me, the far bigger issue is the cost of healthcare in this country. And you know, we talk about Obamacare, you talk about the Republican plan, you talk about other schemes. It's kind of just moving the shells around. And until we can figure out a way to lower the cost of healthcare, no matter who is paying for it, I think it's going to be a losing battle. And there are, I'm no expert on any of this stuff, but I think there are a couple of things which to me jump out there as to why it's so expensive. First of all, the drug companies have so much power in this country, and you see it in a law as simple as that Medicare is prohibited by law from negotiating with drug companies for drugs for Medicare recipients. It's just crazy, and it's almost criminal, I think. So that's easy pickings. We ought to change that. Secondly, and again, I'm not no great student of this, but if you look at countries where the cost of healthcare is much lower than ours, but their results are equally as good, if not better, you see we're out of whack. In those countries, there are many, many more primary care physicians as a percentage of their total physician pool, and fewer specialists. And here in America, it's almost exactly the opposite. Fewer primary care doctors, more specialists. And that, by its very nature, I think, drives the cost of healthcare up. So there are some things we need to do, but very few people in Washington are talking about cost as opposed to access. And I think we really need to shift the conversation.
Yeah, and that's sort of the linchpin of a lot of arguments comparing us to major Western countries that pay less on health care. And so when you look at these countries doing better than us, do you consider a Medicare for all system that treats health care as a right, not only for the people, but because it will lead to better economic outcomes?
Yeah, I don't know, and this is where I kind of have to stop. I'm not sure what the solution is. You know, countries that have more universal health care, it's expensive too. It's not cheap.
Yep.
They have their own problems in terms of access and waiting times and all the rest. But it's impossible to be a defender of the status quo in this country. Let's put it that way. And there are some things we know we could be doing which would help, and we're not doing them. But for instance, part of the reason we don't have enough primary care doctors is because medical school is so expensive, and people are coming out of medical school with huge debts, huge medical school debt. And if they're going to work as a primary care physician and make just a fraction of what they would make as a specialist, you can see where people gravitate. We needed to change those incentives so we're getting more of the mix we need.